Hello and welcome to Beauty Talk with me, Cindy Nell Roberts, Denise Simba, and our expert today, plastic surgeon, Dr. Conrad Pienaar. Conrad, so happy to have you here.
So excited for this
Denise
one
has so many
today.
questions.
I'm like holding my breath. How are you?
Very good, thank you.
Very
And
nice
yourself?
to meet you. I'm good, thank you.
Nice to meet you.
Conrad, I haven't seen you in ages. And the
Are you
last
just
time,
as pretty as always,
Thank
Cindy?
you. Last time I saw you, I was a lot more naked than this. Doctor, obviously, first thing we want to know is what are the most popular plastic surgery treatments at the moment, and which ones are popular between men and women?
Okay. Well, Cindy, you can divide it in three life periods, and there's different procedures that are more popular in certain areas. Typically for women between 20 and 30, it's still breast work. You
Wow, so young.
Either breast bigger or breast smaller, or asymmetrical breast to get them more symmetrical.
Oh, okay.
And then from about 30 to 40, we try to correct all the things that that the birthing process.
These ones that do this.
Exactly. So mommy makeovers, where
Yeah.
we do liposuction, tummy tucks, and again getting your boobs where they need to be.
Don't be like talking about somebody else. He's talking about us.
Yes.
As children.
Yeah, that's why I'm like, these ones. We know these ones. Yes, continue.
At age 40 to 50 is where the face starts to age, and the typical areas that shows first is the upper and lower eyelids, and that's where we go and do the upper and lower lid lifts. And then the later ages from 50 onwards is where the face starts to age, and that's where we do the eyebrow lifts and the face lifts and the neck lifts. For men, it's similar, except that everything is just delayed by 5 to 10 years.
Oh, that's not fair.
That's not fair.
That's not fair. How come?
And also,
I
then
think
get
men age, just sorry to interrupt, Cindy. Men age just as quickly. It's just they are more reluctant to have their surgery because they're scared.
Oh, okay.
And then they see how hot we look, and then they go,
And
okay.
then,
I'm taking too long.
Gotta bite the bullet, have it done.
I have it done. So one of the most popular treatments is obviously breast augmentation. And I know from my own personal experience, when I was younger, I wanted bigger breasts. And then I had to go back and make them smaller again, because when I got older, I thought, I think boyish figure is more feminine. And what should you take into consideration? I wish somebody had told me that way back when. But what should you take into consideration when you think about a breast augmentation?
I think the most important thing is you need to do it for yourself. You shouldn't do it for a boyfriend or a girlfriend or a life partner or their demands. You should do it for yourself. If you're a very athletic person that runs around every day, you don't want boobs that bounce up and down the whole day because they're going to sag out. But in general, younger women want bigger boobs that's a little bit more projectile, and older women want slightly less protuberant boobs. But there is a size that fits your body the best. It's like shoes, you can try and squeeze a number 8 into your number 9 shoe, but it just won't fit. And that's why you need to see a plastic surgeon, because depending on how tall you are and the width of your breast, there is a perfect size for your chest size.
So you take your proportions into consideration.
Yeah.
That's important.
Exactly.
But I do find that, you're a little bit more excited about having bigger breasts. And as you get older as a woman, you definitely want more proportions and smaller breasts. I mean, I'm even thinking about having another reduction because I'm enjoying it. I think small boobies are such a vibe. I mean, they don't look very small today, but...
I mean, they look great.
But I think it's important also where you're at in your life. And I think,
Yes.
Doctor, you did say they don't last forever anyway, right?
It is something that is very important. And, it's something that we've learned over the years, that your silicone implants are like the tires of a car, where you need them replaced every 10 to 15 years.
Oh.
It's not a once-off procedure and that's that.
So in that regard, if you're just doing a reduction without anything in your boobs, that lasts, right?
That lasts because it's your own
Yeah.
skin and fleshy bits. There's no abnormal tissue or no silicone in there.
Okay.
And then in that case, you would also do a bit of a lift at the same time.
Yes.
You would do. But
Is that what you're considering, Denise?
Listen, Doc, I need an extreme lift, like up to the heavens lift.
Look, the problem is if you had been pregnant, the whole process of lactation and breastfeeding makes your boobs go double the size that they should be, and it stretches the skin and it stretches everything. And then once baby stops breastfeeding, your boobs undergo involution, and so you end up with flat or deflated boobs that hangs down too low, and you need to tighten everything up and get it back to where it needs to be.
And what is the recovery process when you do that? Because you have to basically get rid of some tissue now because...
Exactly. You have to, it's like you have a bag with too little stuff in the bag.
Yeah.
You need to make the bag a bit smaller.
Okay.
So you need to resect quite a bit of skin to get the volume back, or to get the boobs to where they need to be with the existing volume. It's not to answer your question, it's not a hectically painful procedure. It's
not.
Typically a day procedure where we go and do a boob lift.
Okay.
And you'll stay overnight in hospital, and the next morning you'll go home.
Because I'm quite a laugher. I'm like, so I don't know. Will it be like that for a couple of months?
Laughing.
No laughing
No
for
laughing.
you.
Laughing
Straight
is-
jacket.
Laughing is not a problem. Because there's no influence on the boobs. It's about you don't want to lift your elbows above your shoulders for the first 2 weeks. But for the rest of it, you can pretty much, from the get-go, start moving around.
Okay, that's good to know. Because
Listen, smaller boobies are trending.
Yeah.
So a little lift, a little smaller. It's a big thing. And how much do these procedures cost? Sure, like breast augmentation, for ballpark.
Ballpark figure, you would look at about between 90,000 and 100,000 for a breast augmentation.
So the price of a
But
little
remember,
car.
that's everything inclusive. That is the facility, the anaesthetist, the surgeon, the implants, and everything.
Oh, okay. So if you don't get implants, and it's like for me, just wanting to make like my boobs a bit smaller and like right under my chin.
It will
Extra
be
for that.
approximately, it'll probably be a little bit cheaper because you don't have implants. And implants are quite expensive.
Yeah.
Yeah.
And then, of course, to then have to always like upkeep them.
Exactly. And having them replaced every 12 to 15 years.
I know one thing that a lot of people want to know when it comes to, so I'm obsessed with not having scars on my body.
Yeah.
And Dr. Pienaar's been through this, and it's all about the healing of the scar because I've seen scars on some of my girlfriends where they heal perfectly, and then I've seen scars that have keloided. And I know that I actually, when I had my cesarean done, I had a keloid, which I then had to have cut out, and you need a plastic surgeon to do that. Oh, wow. So what is the scarring? That is the thing that a lot of people want to talk about. How do you prevent from getting keloids? Is it possible to prevent that? And then the third question is, where are all the different places they make the incisions? So let's specifically focus on breast augmentation.
So scarring, there's a couple of things. You know, as plastic surgeons, we are taught and we spend 10 to 15 years getting trained to, number one, do gentle tissue handling, to put the scars in places where they're less obvious. The fact of the matter is, whenever you do surgery, when you make a cut, there's going to be a scar. You can't get away without surgery and not having any scars. So our aim is to get the scars as pretty as possible. And 96% of scars heal really well. You know, you do your surgery, the patients listen to what you say, you treat it post-operatively the way it should be, and you end up with a thin little white line. Those are the best scars. Sometimes in 1% of cases, scars stretch out and you get a stretched scar. 1% of cases, you get a hypertrophic scar where the scar's elevated, and in 1% of cases, you get keloid scars. And although we as plastic surgeons treat every single patient exactly the same and we do the incisions exactly the same, 96% will heal beautifully, but 4% will have scar problems. And that just means that there's something intrinsic in the patient that makes them scar not so well. And the question is, what are those things?
Yeah.
And the things are typically smoking is the worst thing for scars that you can think of. Not having enough proteins. And the important thing here is animal proteins. A lot of our patients are very healthy and they are vegetarians and vegans. But the problem with vegetarianism and veganism is that they don't get in the essential amino acids. And out of the 22 amino acids, which are the building blocks of protein, 9 of them are essential, and you only get in animal products.
Wow, that
I
is so
didn't know that
interesting.
at all.
Gone on my vegan days.
So and it's one of those things. You want to help. You want to create a really beautiful product, but your hands are tied because the patient doesn't eat animal proteins.
And it's so interesting because as I was saying, I had a keloid on my cesarean scar, which obviously is done by a gynecologist, but then had to have it, cut out by a plastic surgeon. But on other places in my body, I didn't scar at all.
Yes.
So isn't that interesting?
That is
so one person could also sometimes scar and sometimes not scar.
I wanted to ask, okay, can we move down to the...
Yeah, let's move down,
Let's
baby.
move, can we move
Let's
down? Okay, great.
I was going to move up, but we can move down. We can come back up.
Okay, so I want to know, I literally just had a baby like almost 18 months ago, and I'm working out, and I don't like the idea of doing a tummy tuck because that's like from one end to the other, and I suffer from keloids. I mean, if you had to feel my cesarean scar now, it's like literally what you said, lifts.
Yes.
So is it possible that I can work out enough to have liposuction to then work out the rest so I can without the... If that makes sense.
Yes. So the long and short is that to get the best results, you want to be on your ideal weight. And the question is, what is ideal weight? And ideal weight is if you 1.5 meters tall, your ideal weight is 50 kilograms. 1.6, 60, 1.7, 70, 1.8, 80. So you just drop the 1 in front, and that's your ideal weight. And if you on your ideal weight, that is pretty much where you want to be in your case.
Yeah.
Say, for instance, you 1.6, then you want to be around about 60 kilograms before you have your plastic surgery. And then the second thing is there excess fat or excess skin? If there's only excess fat, it's very simple to go and liposuck it out, and you'll flatten things out if you're on your ideal weight. But if you have excess skin, there's no way you can get rid of that skin without cutting it out. And then it's like a C-section scar is about 10 centimeters. Abdominoplasty scar is 30 centimeters plus.
Oh my goodness.
Luckily, we hide it in the bikini line, but it is still... It's a visible scar.
But the liposuction on its own, you need to be the ideal weight for your body, but this is when you specifically have because I always think you do liposuction when you're not at your ideal weight. That's the whole point.
That's a misconception.
It's a misconception.
Yeah. People think that you do liposuction as a weight loss procedure, but it's not. Liposuction is for those fat or diet-resistant fat pockets that you can't lose when you on a diet. So you are 1.7, you weigh 66 kilograms, everything is perfect, but you've got these love handles that you just cannot get rid of, or your inner thighs or your jelly belly. And if you start losing more weight, you'll find that then you lose weight in other places. So that's where liposuction is indicated for, to go and do actually liposculpture of those diet-resistant fat pockets to get your profile exactly where you want it.
That I need.
So
That's the one.
So ladies and gentlemen, liposuction is not for lazy people. You don't get to fix your laziness with liposuction.
So, if you look at, you can only liposuck 6% of the body mass.
At a time or?
Safely for any person.
Okay.
So if you weigh 100 kilograms, you can only safely liposuck 6 kilograms, which is 6%. And if you take someone that weighs 100 and you make them 94, they're still overweight.
And
So they need to get to their ideal weight before you can.
Okay.
And the tummy tuck is for when you have excess skin.
When
And
there's
you need
excess-
to have the excess skin removed. And that most often goes hand in hand with liposuction.
Yeah.
Okay, so that makes sense. Now, while we're down there,
Yeah.
let's talk about butt lifts. Is it a big thing? I hear it's a big thing.
It is.
What are the risks? What are the rewards? Do they
Yeah.
move the fat around? Do they do an implant?
So there's different
Denise
things.
doesn't need one,
Not at all.
as you can see.
There's different things to a butt lift. Number one, in the older Caucasian patients, our butts sag down. And you can see it when you walk on the beach in Italy. The women all have these like sagging down
Oh,
butts.
yeah.
And that's when you need a butt lift. It's like a tummy tuck, where a tummy tuck is in front and you lift everything up and you flatten the tummy. You go, instead of just cutting in front, you cut right around and you literally lift the butt skin up to do a butt lift.
Oh, wow.
Then we combine that, we take the areas that we liposuck and we inject the fat into the buttocks to make the buttocks nice and stiff again. It's like a Brazilian butt
Lift.
Yes.
Wait, so like I thought bums was all muscle.
They are mostly, your gluteus maximus is your
Yeah.
biggest muscle.
Okay.
But there are a lot of fat on the bum.
Okay. Can you do butt reductions on natural big booty?
I mean, nobody
jeans?
wants a butt
I
reduction,
mean, there's
Denise.
some people who are just like.
We want more booty.
I mean,
tighter booty.
there might be people just like, I can't sit on a plane seat because it's going onto the other seat.
So the ideal there is, again,
And then she has to pay 2 tickets.
so again, the principle is get onto your ideal weight.
Okay.
And the trick, there's 3 ways of doing that. The first is a diet with a dietitian, hard work. Second way is
Spinning
bariatric
bike.
surgery, where they literally go and do endoscopic surgery and shrink your stomach or put the balloon in, and you can't absorb food and you lose weight. And the third way these days is Ozempic, where they've got the semi-glutide injections and you literally lose weight.
Yeah, so Ozempic, baby. But
Apparently
that's a
they have-
conversation for another day.
Okay.
So we're going to wrap it up with facelifts, because this is something
Yes.
a lot of people want to know about. And maybe one day Denise and I will also want to know about. So we're
Yes.
just getting ourselves mentally prepared for this conversation. What's the right age to consider a facelift? And what is your best advice around facelifts?
You know, Cindy, in the olden days, we used to get our patients come in for a facelift when they were like 60, 70 years old. And you had to stretch them so much, and you literally just pulled them tighter, but you didn't get them prettier. So these days, our aim is different. We get our patients earlier. We start with smaller procedure earlier on. And I would say the first thing that you want to do is skincare. Second thing is you want subcutaneous maintenance, i.e. a bit of Botox and fillers to keep up the volume in your face. Okay. But if you see that you're starting to look funny with all the fillers in your face and you actually have too much lax skin, that's when you need a little bit of that skin removed. And what we aim as plastic surgeons, we get you when you like early 50s, mid 50s. We take you back with a simple facelift to your mid 40s, and we keep you at your mid 40s for the rest of your life.
Oh, wow.
Oh, wow.
Yeah.
That's amazing.
So smaller procedures, more focused, much quicker recovery time, and less downtime. And yeah, that's the aim these days.
So plastic surgery has already changed quite a lot. I mean, just in the last 5 years, and procedures and the way that you do things. But what do you see are the trends for the future? What's starting to happen now that we haven't seen before?
Exactly what I told you now. With social media, people know what they want, they see what they want, and they're out there they know where they can go and get it. So we see younger people coming in for their cosmetic surgery, smaller procedures, more focused, on a more regular basis. So you don't have really old, dilapidated tissues that you need to go and pull up when they're 70 years old one day.
But But it's not detrimental in the long run. Like the younger I get surgery.
It's like maintaining your car. Taking your car for a service every year.
Okay.
Your car will stay running and in a better condition for longer than just like driving it into the ground and having it trying to fix it when it's like completely
Busted.
bad.
Yeah. Do surgeons do surgery on each other?
Yes, we do.
Oh, is that a little secret?
But Dr. Pienaar, I mean, next time you see a surfer, Denise, or surfing or a bicycle going past you, just think that could be a surgeon because they're cool like that these days.
Okay,
you know?
okay, that means I just need to hang out there all the time.
So we have learned a lot. Basically, I want more booty, and Denise wants less. So can you take out from her and put it? Dr. Pienaar, thank you so much. That was very informative.
Thank you very much for having me.
I think we've answered a lot of questions.
Yeah,
Denise and I will go have a little caucus about what we need to do.
Yeah, I need to do a lot of stuff.
Thank you very much, Doctor.
Thank you.
Thank you, Cindy.
That's it for today's Beauty Talk with me and Denise and our expert, plastic surgeon, Dr. Conrad Pienaar. We will see you again next week with a new interesting topic.